Welcome back to Ozarks Fox. Cervical cancer and breast cancer continue to be a threat to women's health worldwide. More than 265,000 women die from cervical cancer every year across the globe. That number could increase by 66% by 2030. That's just in 10 years. In Missouri, the American Cancer Society estimates 270 new cases and 90 cervical cancer deaths in 2020. For breast cancer, the American Cancer Society estimates this year Missouri will have more than 5,300 new cases and 860 deaths. And screenings and treatment can cost a lot. Missouri has a program that helps uninsured and low-income women pay for the cost of screenings and follow-ups. It's called the Show Me Healthy Women program. We are learning more about it and a request through legislation to keep it funded with Tim Freeman with ACS CAN. That's the American Cancer Society Cancer Action Network. Tim, thank you so much for being here with us.
Thanks for having me. I appreciate it.
So first, I want to talk a little bit about the Show Me Healthy Women program. We'll start with the state, and then we also are going to be talking about the Global Health Fund, and that's cervical cancer efforts throughout the world.
Right. Exactly.
So Show Me Healthy Women, tell me about that program. What is that?
So the Show Me Healthy Women program is a program through the Missouri Department of Health, and it's for uninsured or underinsured women here in the state of Missouri that can go and get a free mammogram or pap test. And a lot of women across the state don't even know that the program exists. And so what we like to do, we have a twofold effort. Number one is just to promote the program so that more women know about it. But then legislatively, each year, the program has to be funded through the state. And so we advocate every year for, it's a $500,000 appropriation through the state appropriations process. And we advocate every year with our legislators to make sure that that $500,000 is part of the state budget so that the program can continue.
Where is that process right now?
So the legislature just went into session here first part of January, and we'll kind of go through the process. They'll do their budget bills in the next few months, and right now the $500,000 is part of the budget, and we'll just have to make sure that as the process continues until it's finally voted on, that that amount of money stays in the budget for the program. But right now we've had success each of the past several years. We've been able to maintain that $500,000 for it. So legislators, the more we educate them and the more they learn about the program and the good things that it does, they're pretty good about making sure that that money is maintained, and we feel pretty good that that'll be the case this year as well. But it never hurts to continue to tell the story.
Do you ever try to increase that? Do you feel like the $500,000 is taking care of what you needed to take care of right now?
So as long as the state does at least the $500,000, then there's a federal match from the federal breast and cervical cancer program as well. So the total amount will be a little bit more once the federal money comes in as well, and then just let people know in general that the program exists.
Yeah, you mentioned the awareness and the fact that a lot of women might not even know that this is an option for them. I watched a video that you sent me on the website talking about a woman who said, I didn't have insurance at the time when I found out that I had breast cancer, and if it wasn't for this program, she wouldn't have continued her treatment. So if you can ask your doctor about this, the clinic you're going to, the hospital you're going to, is that how it works? Is that where you start talking to your doctor about it?
Yeah, providers is a great way. If a woman is deciding whether or not if she isn't insured or she's not sure if her insurance will cover, if she wants to go, I know the Jordan Valley Health clinics here in Greene County, I think, are all Show Me Healthy Women providers. The state Department of Health website has a Show Me Healthy Women part on the website, and people can go there, and there's actually a clickable map on there, and so they can go to their county, click on the county, and it will bring up the names of all the Show Me Healthy Women providers in the county. So that's a great resource.
Tim, I also want to talk about the Global Health Fund, which is more of a global effort when it comes to cervical cancer and the prevention efforts and screening. Tell me about that, and how is ACS CAN and you here in Missouri connected to this global program, Global Health Fund?
Well, there are a lot of low-income countries across the world who don't have the ability to provide programs for women with cervical cancer. And so here in the United States, over the next 30 years, cervical cancer deaths are going to decline by about 50%. Unfortunately, worldwide, the trends show that over the next 20 years, they're going to increase by 50%. And the reason that they're going down here, and the third or the second good news part of it, is that we can virtually eliminate all deaths from cervical cancer through prevention, early detection, and treatment, as long as those prevention, early detection, and treatment options are available. And so what we at ACS CAN are doing on the federal level is we're trying to educate our members of Congress in Washington, D.C. about cervical cancer and the things that we can do to prevent it. And what we're asking is for them to increase funding for cervical cancer, specifically in the Global Health Fund. Last year, the Global Health Fund was about $11 billion, and that's a fund that goes out to countries to help them improve the quality of life, medical, for people across the world in underdeveloped countries. And whether it's malaria, HIV, lots of different things. And so less than 0.5% of that $11 billion last year went specifically to cervical cancer. So we're trying to increase the amount in the Global Health Fund that would go specifically to cervical cancer.
Why should ACS CAN here in Missouri, and why should we here in Missouri be worried about a Global Health Fund and an issue that is affecting people in different countries?
There are so many different types of cancers, and any time that there is one that we can virtually eliminate, I mean, think about that, eliminate a specific type of cancer. If there's a way to do that, and you know, like I said, the trends here in the United States are that more people are going to survive cervical cancer or not get it at all. And if we have the ability to do that here in the United States, if we can save lives across the world, I think, you know, our organization, that's something that we definitely want to do, and I think legislative leaders are interested in that as well. But I think anything that we can do, like I said, virtually eliminating a specific cancer is a pretty big accomplishment, and I think for us to be the leaders in that here in the United States and for our elected officials to take the lead on doing that on a world stage, I think is pretty impressive and something that folks would want to get behind.
And if people want to be a part of that, they can find ACS CAN on Facebook and online. And we'll have all of that information in this story on our website. That's ozarksfirst.com. You can find information on the Show Me Healthy Women and the Global Health Fund. Tim Freeman, thank you so much for being here.
Thanks for having me. I appreciate it.
And we'll be right back with more right here on Ozarks Fox.